Cirrhosis is a serious condition that occurs when healthy liver cells are damaged and replaced by scar tissue. Your liver is a vital organ that performs over 500 essential functions. But when the liver is subjected to chronic, long-term damage, it attempts to repair itself after injury. So it replaces damaged tissue with scar tissue. Over time, the accumulation of scar tissue distorts the liver's internal structure, blocking blood flow through the organ. This not only further damages the remaining healthy liver cells, but also leads to portal hypertension, which is a condition where blood pressure in the portal vein, which carries blood from the digestive organs to the liver, becomes abnormally high. Cirrhosis is a progressive disease, meaning it gets worse over time, and it can eventually become life-threatening. Globally, cirrhosis is responsible for over 1 million deaths annually. Causes of cirrhosis. Cirrhosis has a variety of causes, each leading to liver damage over an extended period. Chronic alcohol abuse is one of the most common causes, as excessive alcohol intake can lead to alcoholic liver disease, which progresses from fatty liver to alcoholic hepatitis and eventually to cirrhosis if alcohol consumption continues. Viral hepatitis, particularly hepatitis B and C, is another leading cause. Chronic infection with these viruses can cause ongoing inflammation and liver damage, which results in cirrhosis. Non-alcoholic fatty liver disease, NAFLD, is also increasingly recognized as a major cause of cirrhosis, driven by obesity, insulin resistance, and metabolic syndrome. This condition ranges from simple steatosis, which is simply fat accumulation in the liver, to non-alcoholic steatohepatitis, or NASH, which involves inflammation and fibrosis and can progress to cirrhosis. Other causes of cirrhosis include autoimmune hepatitis, where the body's immune system attacks liver cells, genetic conditions such as hemochromatosis and Wilson's disease, which cause abnormal accumulations of iron and copper in the liver, respectively, and long-term exposure to toxins and drugs. Symptoms of cirrhosis. The symptoms of cirrhosis can be insidious and may not become apparent until significant liver damage has occurred. In the early stages, many people with cirrhosis experience no symptoms at all, which is why the condition is often referred to as a silent disease. As the condition progresses, however, a range of symptoms may develop. One of the earliest signs of cirrhosis is often fatigue. People with cirrhosis may feel tired all the time, even after a full night's sleep. This fatigue can be overwhelming and can significantly impact daily life. Along with fatigue, many people experience weakness and a general sense of being unwell. As liver function declines, people may notice a loss of appetite and unintended weight loss. The damaged liver struggles to process nutrients effectively, leading to malnutrition, even if a person is eating normally. Some individuals may experience nausea, particularly after meals. Jaundice, which is a yellowing of the skin and whites of the eyes, is a classic sign of liver disease. It occurs when the liver can't properly process bilirubin, which is a yellow pigment produced when old red blood cells are broken down. Along with jaundice, some people may notice that their urine becomes darker, often described as tea-colored, while their stools become lighter. As cirrhosis progresses, fluid may begin to accumulate in the abdomen, a condition known as ascites. This can cause abdominal swelling and discomfort, and in severe cases can make breathing difficult. Similarly, fluid can accumulate in the legs and ankles, causing swelling known as edema. Spider veins, also known as spider angiomas, are another common symptom. These are small, spider-shaped blood vessels visible under the skin and are caused by the increased estrogen levels that occur when the liver is damaged and unable to metabolize hormones properly. Portal hypertension, or the increased blood pressure in the portal vein system, can lead to the development of varices. These are enlarged blood vessels, most commonly in the esophagus and stomach, which can rupture and cause life-threatening bleeding. Cirrhosis can also affect brain function, leading to a condition called hepatic encephalopathy. This can cause confusion, personality changes, and in severe cases, coma. Many people with hepatic encephalopathy describe feeling foggy or having difficulty concentrating. Other symptoms can include easy bruising and bleeding due to the liver's decreased ability to produce clotting factors, itchy skin, and for men, gynecomastia, or enlarged breasts, and testicular atrophy due to hormonal imbalances. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of cirrhosis. To diagnose cirrhosis, your doctor will look for signs of liver disease such as jaundice, spider angiomas, redness of the palms, and signs of ascites or edema. They may also feel the abdomen to assess the size and texture of the liver. Blood tests are crucial in diagnosing cirrhosis. Liver function tests can reveal elevated levels of enzymes like ALT and AST, which indicate liver cell damage. Other blood tests may show decreased levels of albumin, which is a protein produced by the liver, or increased bilirubin levels. A complete blood count might reveal anemia or a low platelet count, both common in advanced liver disease. Imaging studies play a key role in diagnosing cirrhosis. Ultrasound, CT scans, or MRI can show changes in liver size and texture characteristic of cirrhosis. These imaging techniques can also detect signs of portal hypertension, such as an enlarged spleen or the presence of varices. In some cases, especially when the diagnosis is uncertain or when it's important to determine the extent of liver damage, a liver biopsy may be performed. This involves taking a small sample of liver tissue, usually with a needle, and examining it under a microscope. A biopsy can confirm the presence of cirrhosis and may help identify the underlying cause. Non-invasive tests for liver fibrosis, such as FibroScan, which is a type of ultrasound that measures liver stiffness, or blood tests that use markers of fibrosis, are becoming increasingly popular as alternatives or adjuncts to liver biopsy. Treatment for cirrhosis. The treatment of cirrhosis focuses on two main goals: addressing the underlying cause of liver damage and managing the complications of cirrhosis. For alcohol-related cirrhosis, the most crucial step is complete abstinence from alcohol. This can stop the progression of liver damage and, in some cases, allow for some recovery of liver function. In cases of viral hepatitis, antiviral medications can be used to suppress or eliminate the virus. For hepatitis C, newer direct-acting antiviral drugs have revolutionized treatment, offering cure rates over 95% for most patients. For hepatitis B, while a complete cure is not yet possible, long-term antiviral therapy can effectively suppress the virus and reduce liver damage. For cirrhosis caused by NAFLD or NASH, lifestyle modifications are key. This includes losing weight if overweight or obese, following a healthy diet, exercising regularly, and controlling diabetes and high cholesterol. Some medications, such as vitamin E or pioglitazone, may be recommended in certain cases. Autoimmune causes of cirrhosis are typically treated with immunosuppressive medications to reduce the immune system's attack on the liver. For genetic disorders like hemochromatosis or Wilson's disease, treatment involves removing excess iron or copper from the body. Regardless of the underlying cause, managing the complications of cirrhosis is a crucial part of treatment. For portal hypertension and varices, medications called beta blockers may be prescribed to lower portal pressure. In cases of large varices or previous bleeding, endoscopic procedures to band or seal off the varices may be necessary. Ascites is often managed with a low-sodium diet and diuretic medications. In severe cases, large volumes of fluid may need to be removed directly from the abdomen through a procedure called paracentesis. Hepatic encephalopathy is typically treated with medications like lactulose or rifaximin, which help reduce the levels of toxins that the damaged liver cannot process. Dietary protein may need to be adjusted, and any triggers, such as dehydration or infections, should be promptly addressed. In cases of advanced cirrhosis, where the liver can no longer function adequately, liver transplantation may be the only option. This is a major surgical procedure where the diseased liver is removed and replaced with a healthy liver from a donor. While liver transplantation can be life-saving, it's a complex process with its own risks and challenges, including the need for lifelong immunosuppressive medications. It's important to note that while cirrhosis itself is generally irreversible, treating the underlying cause can stop or slow the progression of liver damage. In some cases, especially if caught early, there may even be some improvement in liver function. Now, we want to hear from you. Do you or someone you know have cirrhosis? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.